Picture this. It's 3 in the morning, and you wake up with your heart pounding so hard you can hear it in your ears. Your chest feels tight, your hands are trembling, and for some inexplicable reason, you're absolutely convinced something terrible is about to happen. You reach for your phone to Google your symptoms, and congratulations, you've just diagnosed yourself with approximately 47 different fatal conditions. Sound familiar? Well, before you start writing your will, let me tell you something that might surprise you. What you're experiencing isn't a heart attack, it's not a stroke, and you're probably not dying. What you're dealing with is anxiety, and it affects over 300 million people worldwide. That's right, 300 million. So if you thought you were alone in this midnight panic party, think again. Welcome, everyone. I'm Dr. Hannah, and today we're diving deep into one of the most misunderstood conditions in modern medicine, anxiety disorder. Now, I know what you're thinking. Anxiety? Really? Isn't that just what happens when you have too much coffee or when your mother-in-law announces she's coming to visit? Well, not exactly. Clinical anxiety is far more complex, far more debilitating, and unfortunately, far more common than most people realize. Over the next 20 minutes, we're going to explore everything you need to know about this condition. We'll discuss what anxiety actually is, the surprising root causes that trigger it, the symptoms that differentiate normal worry from clinical anxiety, and most importantly, we'll cover evidence-based treatment methods including natural approaches that can genuinely help. So settle in, take a deep breath, and let's begin this journey together. Let's start with the fundamentals. What exactly is anxiety? At its core, anxiety is your body's natural alarm system, the famous fight-or-flight response that kept our ancestors alive when they encountered predators. When you perceive a threat, your brain activates the amygdala, which then signals your body to release stress hormones like cortisol and adrenaline. Your heart rate increases, your muscles tense, your breathing becomes rapid, and your senses sharpen. This is all perfectly normal and actually quite useful when you're facing genuine danger. The problem arises when this alarm system becomes hypersensitive and starts going off when there's no real threat present. It's like having a car alarm that triggers every time a leaf falls on the windshield. Technically functional, but absolutely exhausting. Now, anxiety exists on a spectrum. On one end, you have normal, everyday worry. Will I be late for this meeting? Did I remember to turn off the stove? These are rational concerns that motivate us to take action. On the other end of the spectrum, you have anxiety disorders, where the worry becomes excessive, persistent, and interferes with daily functioning. According to the World Health Organization, anxiety disorders are the most prevalent mental health conditions globally, affecting approximately 4% of the global population. That's more than depression, more than bipolar disorder, more than schizophrenia. And here's the kicker. Women are nearly twice as likely as men to develop an anxiety disorder. Ladies, we really can't catch a break, can we? There are several types of anxiety disorders, each with its own characteristics. Generalized anxiety disorder, or GAD, involves persistent and excessive worry about various aspects of life. Panic disorder is characterized by sudden, intense episodes of fear accompanied by physical symptoms. Social anxiety disorder involves overwhelming worry about social situations and being judged by others. Then we have specific phobias, obsessive-compulsive disorder, and post-traumatic stress disorder, which all fall under the anxiety umbrella. For today's discussion, we'll focus primarily on generalized anxiety and panic disorder, as these are the most common presentations. Let's talk about the symptoms, because recognizing anxiety is the first step toward managing it. And let me tell you, anxiety doesn't just live in your head. Oh no, this condition has the audacity to affect your entire body. Let's break down the 8 core symptoms you need to be aware of. Symptom number 1, excessive worry that's difficult to control. We're not talking about normal concern here. This is persistent, intrusive worry that dominates your thoughts for most days over at least 6 months. You find yourself catastrophizing, always imagining worst-case scenarios, and struggling to focus on anything else. It's exhausting, and it feels impossible to shut off your brain. Symptom number 2, physical tension and restlessness. Your muscles feel constantly tight, particularly in your neck, shoulders, and jaw. You might find yourself pacing, fidgeting, or feeling like you need to move. Some people describe it as feeling keyed up or on edge all the time. It's like your body is permanently braced for impact, even though nothing's actually happening. Symptom number 3, sleep disturbances. Yes, the 3 a.m. wake-up call we mentioned earlier. Anxiety loves to mess with your sleep. You might have trouble falling asleep because your mind won't stop racing, or you wake up in the middle of the night with your thoughts spiraling. Some people experience both. And the cruel irony: poor sleep makes anxiety worse, which makes sleep even harder. It's a vicious cycle that would be funny if it wasn't so miserable. Symptom number 4, difficulty concentrating. Your mind feels foggy, you lose track of conversations, and simple tasks suddenly seem overwhelming. This happens because your brain is expending so much energy on worry that there's not much left for other cognitive functions. Students and professionals often notice this symptom first because it directly impacts their performance. Symptom number 5, irritability. Everything annoys you. Your colleagues' typing sounds like thunder, your partner's breathing feels aggressive, and don't even get me started on people who chew loudly. Now, before you blame your naturally delightful personality, know that irritability is a classic anxiety symptom. Your nervous system is overstimulated, making you more reactive to minor annoyances. Symptom number 6, physical symptoms that mimic serious medical conditions. This is where anxiety really shows its creativity. Rapid heartbeat, chest pain, shortness of breath, dizziness, nausea, sweating, trembling, numbness, tingling sensations. The list goes on. These symptoms are so convincing that many people end up in emergency rooms convinced they're having a heart attack, only to be told it's anxiety. And here's something important to understand: these symptoms are real. They're not all in your head or imaginary. They're genuine physical manifestations of your body's stress response. Symptom number 7, avoidance behavior. You start avoiding situations, places, or activities that trigger your anxiety. Maybe you stop going to social events, or you avoid driving on highways, or you make excuses not to travel. Over time, your world gets smaller and smaller as anxiety dictates what you can and cannot do. Symptom number 8, panic attacks. These deserve special mention because they're terrifying. A panic attack involves a sudden surge of intense fear that peaks within minutes and includes symptoms like heart palpitations, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, and a sense of impending doom. People often describe feeling like they're dying or losing control. The first panic attack is usually the worst because you have no idea what's happening. And then, adding insult to injury, you start worrying about having another panic attack, which can actually trigger more panic attacks. It's anxiety's cruel sense of humor. Now, let's explore what actually causes anxiety. This is where things get interesting because anxiety doesn't have a single cause. It's multifactorial, meaning multiple elements contribute to its development. Think of it like a perfect storm where various factors converge. First, we have genetics. Studies show that anxiety disorders run in families. If your parents or siblings have anxiety, you're more likely to develop it yourself. Researchers have identified several genes associated with anxiety, particularly those involved in serotonin and dopamine regulation. But here's the good news: having the genetic predisposition doesn't guarantee you'll develop anxiety. It just means you're more vulnerable under the right circumstances. Second, brain chemistry plays a crucial role. Anxiety is associated with imbalances in neurotransmitters, particularly serotonin, GABA, and norepinephrine. Serotonin helps regulate mood and anxiety. GABA is your brain's main inhibitory neurotransmitter, essentially acting as a natural calming agent. Norepinephrine is involved in your body's stress response. When these neurotransmitters aren't functioning optimally, anxiety symptoms can emerge. Third, we have environmental factors. Stressful life events, trauma, abuse, chronic stress, and significant life changes can all trigger or worsen anxiety. Job stress, relationship problems, financial difficulties, health issues, these are all potential contributors. Sometimes anxiety develops after a specific traumatic event, but often it builds gradually over time as stress accumulates. Fifth, lifestyle factors play a significant role. Excessive caffeine consumption can trigger anxiety symptoms. Alcohol and drug use, including marijuana, can worsen anxiety despite people often using them to self-medicate. Poor diet, lack of exercise, insufficient sleep, these all contribute to anxiety. Your lifestyle choices can either support your mental health or undermine it. Sixth, personality traits influence anxiety susceptibility. People who are perfectionists, highly self-critical, or have a strong need for control are more prone to anxiety. Those with low self-esteem or negative thinking patterns are also at higher risk. Now, this doesn't mean you're at fault for your anxiety. These are just risk factors, not causes of personal failure. Let's move into the section everyone's been waiting for, treatment and management strategies. And I'm going to spend considerable time here because this is where the real hope lives. Anxiety is highly treatable, and while it may never completely disappear, you can learn to manage it effectively and reclaim your life. Let's start with natural treatment methods, because many people prefer to explore these options first. And the evidence supporting these approaches is actually quite strong. Exercise is one of the most powerful natural anxiety treatments available. Physical activity reduces stress hormones like cortisol while increasing endorphins, your body's natural mood elevators. Regular exercise also improves sleep quality, boosts self-esteem, and provides a healthy outlet for nervous energy. You don't need to become a marathon runner. Even moderate activity like 30 minutes of walking 5 times a week can significantly reduce anxiety symptoms. Yoga and Tai Chi are particularly beneficial because they combine physical movement with breathwork and mindfulness. Speaking of breathwork, proper breathing techniques can be transformative. When you're anxious, your breathing becomes shallow and rapid, which actually perpetuates the anxiety response. Learning diaphragmatic breathing, where you breathe deeply into your belly rather than your chest, activates your parasympathetic nervous system, which is responsible for the relaxation response. Try this. Breathe in for 4 counts, hold for 4 counts, exhale for 4 counts, hold for 4 counts. Repeat for several minutes. It's simple, free, and remarkably effective. Mindfulness and meditation have strong scientific support for reducing anxiety. These practices teach you to observe your thoughts without judgment rather than getting caught up in them. Regular meditation actually changes brain structure over time, increasing gray matter in areas associated with emotional regulation while decreasing activity in the amygdala. Start with just 5 minutes daily and gradually increase. Apps like Headspace or Calm can guide you if you're new to meditation. Dietary changes can significantly impact anxiety. Reduce or eliminate caffeine, as it directly stimulates your nervous system. Limit sugar and processed foods, which cause blood sugar fluctuations that can trigger anxiety symptoms. Increase omega-3 fatty acids found in fish, walnuts, and flax seeds, as these support brain health. Eat regular, balanced meals to maintain stable blood sugar levels. Consider adding magnesium-rich foods like leafy greens, nuts, and seeds, as magnesium deficiency is linked to increased anxiety. Herbal supplements show promise, though you should always consult a healthcare provider before starting any supplement. Chamomile tea has mild anti-anxiety properties and can be particularly helpful before bed. Lavender has been shown in studies to reduce anxiety symptoms. Passion flower and valerian root are traditional remedies with some scientific support. Ashwagandha, an adaptogenic herb, has demonstrated anxiety-reducing effects in multiple studies. Sleep hygiene deserves serious attention because poor sleep and anxiety create a destructive feedback loop. Establish a consistent sleep schedule, even on weekends. Create a relaxing bedtime routine. Keep your bedroom cool, dark, and quiet. Avoid screens for at least an hour before bed, as blue light suppresses melatonin production. If racing thoughts keep you awake, try keeping a journal by your bed to write down worries so you can address them tomorrow. Social connection is therapeutic. Isolation worsens anxiety, while supportive relationships provide emotional buffering. Make time for friends and family. Join support groups where you can connect with others who understand what you're experiencing. Sometimes just knowing you're not alone makes an enormous difference. Now, let's talk about what not to do when you're experiencing anxiety, because sometimes people's well-meaning attempts to cope actually make things worse. Don't rely solely on Dr. Google. Internet searches about symptoms almost always lead to worst-case scenarios and health anxiety. Don't skip meals or load up on caffeine and sugar. These create a roller coaster of blood sugar and energy that exacerbates anxiety. Don't expect instant results. Whether you're trying therapy, medication, or natural approaches, give treatments adequate time to work. Most treatments require weeks or months to show full benefits. Beyond natural approaches, professional treatment options are available and often necessary. Cognitive behavioral therapy, or CBT, is considered the gold standard for anxiety treatment. It teaches you to identify and challenge distorted thinking patterns while developing healthier coping strategies. Exposure therapy, a component of CBT, gradually exposes you to feared situations in a controlled way, helping you learn that the feared outcome rarely occurs. Medications can be highly effective, particularly for moderate to severe anxiety. Selective serotonin reuptake inhibitors, or SSRIs, are typically first-line treatments. They work by increasing serotonin availability in the brain. Benzodiazepines provide rapid relief but carry risks of dependence and are generally used short-term. Buspirone is an anti-anxiety medication with a different mechanism and lower abuse potential. Beta blockers can help with physical symptoms like rapid heartbeat. Medication decisions should always involve thorough discussion with a psychiatrist or qualified physician who can weigh benefits against potential side effects. Let's discuss recovery timeline because everyone wants to know, how long until I feel better? The honest answer is that it varies considerably. With natural approaches alone, you might notice some improvement within a few weeks, but significant change typically takes 2 to 3 months of consistent effort. With therapy, most people see meaningful progress within 12 to 16 weeks of regular sessions. Medications often require 4 to 6 weeks to reach full effectiveness, though some people notice improvement sooner. Here's what recovery actually looks like, and this is important because people often have unrealistic expectations. Recovery isn't linear. You'll have good days and bad days. You might feel better for a while, then have a setback. This is normal and doesn't mean you're failing. Recovery means gradually expanding what you can do, slowly reclaiming activities you'd been avoiding. It means the anxiety episodes become less frequent, less intense, and shorter in duration. It means developing confidence that you can handle anxiety when it arises rather than fearing it will destroy you. After the acute phase of anxiety improves, ongoing management is crucial. This isn't a condition you cure once and forget about. It requires continued attention to the lifestyle factors we discussed: regular exercise, good sleep, stress management, healthy eating, social connection. Many people benefit from occasional therapy booster sessions even after completing treatment. Think of anxiety management like maintaining physical fitness. You can't exercise for 3 months, get in shape, then never exercise again and expect to stay fit. Let's talk about famous people who've dealt with anxiety because there's still significant stigma around mental health, and knowing that successful people struggle too can be normalizing. Ryan Reynolds has spoken openly about his lifelong anxiety struggles. Emma Stone has discussed having panic attacks as a child. Adele has talked about severe anxiety before performances. Johnny Depp, Oprah Winfrey, Lady Gaga, all have been public about their anxiety experiences. These are incredibly accomplished individuals who've learned to manage their anxiety while achieving remarkable success. Anxiety doesn't define you, and it doesn't limit what you can accomplish. The history of anxiety treatment is fascinating. For centuries, anxiety symptoms were attributed to various causes, from demonic possession to hysteria in women, which doctors literally thought was caused by a wandering uterus. Yes, really. Medical science has come a long way, thank goodness. The modern understanding of anxiety began developing in the late 19th century. Sigmund Freud distinguished anxiety from fear and theorized about its psychological origins. In the 1950s and 60s, the first effective anti-anxiety medications were developed. The recognition of panic disorder as a distinct condition happened in 1980 when it was added to the diagnostic manual. Today, Research continues advancing our understanding of anxiety's neurobiological basis and improving treatment approaches. Here's something crucial I want you to understand. Having anxiety doesn't make you weak, broken, or defective. It makes you human. Your brain is doing exactly what it evolved to do, protect you from danger. It's just being a bit overzealous about it. With the right knowledge, support, and treatment approaches, you can retrain your brain's threat detection system and significantly reduce your symptoms. If you're currently struggling with anxiety, please know that help is available and recovery is possible. Start by talking to a healthcare provider who can evaluate your symptoms and discuss treatment options. Consider therapy, particularly CBT, which has strong evidence for effectiveness. Implement the natural strategies we've discussed today. Connect with others who understand. Be patient with yourself because healing takes time. And remember, 300 million people worldwide deal with anxiety. You are absolutely not alone in this struggle. There's a whole community of us out there, waking up at 3 a.m. with racing hearts, convincing ourselves we've contracted rare tropical diseases, and slowly learning that we're going to be okay. Because here's the truth, anxiety is treatable, manageable, and does not have to control your life. Thank you for watching today. If you found this information helpful, please hit that like button and subscribe for more evidence-based health content. Share this video with anyone who might benefit from understanding anxiety better. Drop a comment below about your experiences or questions. I'd love to hear from you. And remember, taking care of your mental health is just as important as taking care of your physical health.